Hello everyone! Today I'm going to talk about another patient safety issue, which is falls. Falls in the healthcare is indeed one of the leading causes of healthcare-acquired conditions. So for today's discussion, the resource that I use is National Database of Nursing Quality Indicators, or NDNQI. To begin, to begin with, I would like to define what fall is. Fall, in its simplest term, is a sudden, unintentional descent resulting in the patient coming rest on the floor or against some other surface. From this definition, we can derive that intentional fall is excluded in data gathering or is not reportable. Fall can also be described as assisted. We say it is an assisted fall if a staff was with the patient and attempted to minimize the impact of the falls by slowing the patient's descent. We only report patients' falls. An observed fall is a fall witnessed by a staff. So how do we minimize fall occurrence among our patients? So we can minimize fall from occurring from the hospital or the organization or in any place by risk assessment. So we use evidence-based tools like Morse fall scales or Cummings scales in pediatrics. And based on the risk level determined, we must institute fall precautions or fall prevention interventions. And what do we do after fall? Always assess the patient first. So always check the patient first. Check for injury. But if you suspect cervical spine injury, be cautious in inspecting or moving the patient. Check for neurological and other clinical assessment depending on where the impact hit. Check for vital signs. Transfer the patient back on the bed only if safe. That means you have asked for assistance in transferring as well. Call the attending provider to evaluate the patient and order imaging as the condition warrants. Provide wound care if present, and document fall event and complete an incident report per hospital policy. So some of the measures that we include in communicating fall include fall risk assessment band placement, which is, again, differs from hospital to hospital. Always lock the bed and put the bed in the lowest position. Organizing the lines, we have patients on monitors, drains, and tubing, so we must organize those, make sure that our patients are not all tangled up, ensure that call light and essentials are within patient reach, and having patient wear non-skid socks. So how do we categorize fall injuries? We categorize injuries based on their severity: non, minor, moderate, severe, or even death. Pain, for example, without injury as evidence from imaging is considered a minor injury. Moderate injury include those needing suturing or such intervention. Severe injury include fracture of any kind and other internal injury or life-threatening injury. These injuries need to examine in a system level, and root cause must be identified and intervention must be made to prevent reoccurrence. So I have made this flyer that we have put in our organization, making sure that all is aware of what to do in order to prevent falls. And I think you can reach out to me if you want to use this flyer, or I can customize for you if you need any. So again, thank you for listening to this to today's topic, and yeah, thank you for hanging out with me and making sure that we make our healthcare and our workplace environment a safe place for our patients and for our colleagues. Thank you.